AM 1580 WVKO The Praise, where we are the voice of the people. Get ready for Let's Talk About Health with your hosts, Dr. Amanda Flowers, Dr. Victor McKoy, and Dr. Mark White, where your health is your wealth. On AM 1580 WVKO The Praise, where we are the voice of the people.
Good morning, Columbus. Thank you for tuning into AM 1580 WVKO The Praise, the voice of the people. Welcome to Let's Talk About Health. I'm Dr. Amanda Flowers in the studio today with Dr. Mark White and Dr. Victor McKoy. Good morning, doctors.
Good morning, good morning, good morning.
Good morning, Columbus, Ohio. It's good to be here. We got some good information today.
We do. I'm excited about the information. Dr. McKoy, did you enjoy your 4th of July last week?
Yes, I did.
We missed you.
I missed you guys. God bless you.
I even called Dr. White, Dr. McKoy. I said, you must have been thinking about us.
I was. Yes, I was.
Well, listeners, we have a great show lined up, as Dr. White said. Although incarceration rates have risen sharply since the 1970s, our system has largely neglected the health effects of imprisonment. Incarceration has powerful effects on health, especially when it instills stigma, as it increases the likelihood of severe health limitations and often has more of an influence on mental health outcomes than any other life experiences. Dealing with health and mental health challenges before, during, and after incarceration will foster positive outcomes for individuals reintegrating back into society. And we have a special guest on the show today to help us understand this process. We're excited to welcome Elder Patrice Palmer to Let's Talk About Health, a licensed social worker, chemical dependency counselor, criminal justice prevention specialist, community advocate, ordained elder of ministry, and the former president of Raising the Bar Prison Ministries at Higher Ground Always Abounding Assemblies. Elder Palmer is the program developer of Chosen for Change Cognitive Behavioral Therapy and founding program director for Conquest at Chillicothe Correctional Institution. Elder Palmer is a member of the Franklin County Reentry Task Force Coalition, the Ohio Attorney General's Task Force, Just Leadership USA Leading with Conviction, the National Association of Social Workers Columbus Chapter, Phi Theta Kappa National Honor Society, and the VFW Ladies Auxiliary Post 3764, where she was the former chairperson to the Voices of Democracy and Patriot Penn Scholarship Program for Youth. Formerly, Elder Palmer was the operations manager at the Exit Program, program director for Jesse's World, founder of the Exit Program for Women, and member of the ACME, a reentry subcommittee through the Ohio Supreme Court. It should be of no surprise after hearing that Elder Palmer has been awarded multiple awards, honors, and scholarships. So good morning, Elder Palmer. It's a pleasure to have you this morning.
It's a pleasure to be here. Thank you.
Thank you. We are so excited. Listeners, we have a wonderful person in front of us, and then we have an extra special guest who's going to be coming in and giving us a little bit of information after our first break as well. So do you have a question for us this morning? Give us a call at 614-824-2139 or 824-2336. Now, doctors and Elder Palmer, the justice system is supposed to be blind, but the reality is economic status, skin color, where you live, who you hire as an attorney are more likely to determine your fate than the facts of your case. Mental health, drug use, and criminal involvement are strongly correlated. However, we live in a society with a two-tiered system that leads African Americans to prison and white individuals to treatment for their wrongdoings. So can you guys let me know, what challenges do African Americans face in the community that lead to incarceration, and what systemic changes need to be made so they're receiving appropriate placement rather than incarceration? And I forgot to warn you, Elder Palmer, that for our guests coming on, the doctors, all eyes are on them. They are so nice. They will give you the first opportunity to speak.
Whoa, okay. Well, thank you. That's an honor. So let me just say that in the United States, we have 5% of the world population, and yet 25% of the world's prison population. Across the nation, we have 2.3 people incarcerated. 1.92 million have a criminal record. African Americans make up 58% of our prison population, which is more than half, which should be concerned. Here in the state of Ohio, we have 52,000 people in 28 different institutions throughout Ohio. When you look at the disproportion and the dispartiality of the criminal justice system, especially when it comes to African Americans, we should be concerned. We should be concerned that when you look at the war on drugs, what have we accomplished after 2 decades on the war on drugs, when many African American males, especially males, are incarcerated 6 times more than white counterparts? That is a problem. When you look at the school pipeline to prison, more African Americans, especially males, are expelled and suspended from schools, which leaves them vulnerable to criminogenic behaviors. That is a problem. When we look at the challenges that we face in the community, oftentimes when it comes to incarceration, health risk and health issues are not addressed in the community, and therefore the fear of trusting needing mental health services or addictive services, the fear of not trusting that, and then being incarcerated. When you look at systemic change, we need an approach that restructures and redefines the criminal justice system.
Absolutely. Dr. White, Dr. McKoy?
Yes, I think this is a really, really important topic, conversation, and in our community, there's a number of reasons I think that the criminal people are incarcerated. One, there are several hundreds, thousands of African Americans that are have mental health problems that are not being treated. So you have mental health problems, untreated mental health in our community here in Columbus. You have misdiagnosis of mental health problems here in Columbus, Ohio. You have children growing up, single parents, seeing drugs and alcohol, and so you have a disproportionate of our African Americans, young African Americans, on just African Americans in general, drugs, alcohol abuse. And so when you mix all of that up with less education and no jobs, poor coping skills, you have a setup for those people to do things that may and do cause them to be incarcerated.
Yes.
And so I think that what we need to do is what we've been talking about on several of our programs is we need to set up before they get into the system. Before they get into the system, before they're arrested and taken downtown, because once they cross that boundary, that's a whole different thing.
Yes.
So we must bring mental health, drugs and alcohol to the forefront. Churches,
yes,
town hall meetings, fraternities, wherever it is, because there's a lot of mental health. It's really has ripped through our community, and this is something that I'm glad that we're talking about it, because the outcome of this is incarceration.
Yes, Dr. McKoy.
And I agree with Elder Palmer and Dr. Mark White. One of the things that I see is the glamorization or glorification of a subculture, drugs and let's say a certain type of music, a subculture of not only that, but a subculture of drugs and just glamorizing this, the drug culture, this culture of violence that's somewhat glamorized by certain of our icons among the young people, that has nothing to do with in other words, they glamorize it on one side, but on the other side, they have families, they have children they're raising. The children are in colleges. I can give some examples like Snoop Dogg. Some of that being glamorized among our young people. And we can give a lot of different artist names, but they have normal families, with wives and children.
Yes.
And when our children look and see what the image they project, it almost seems like it's okay and it's all right.
Yes. And when you talk about that, sometimes it just reminds me of people to get where they need to go. They will create whatever image, whether it's to what extent it is a false image of what's really going on in their house, because negative stuff sells more than positive stuff. And a lot of times we get caught up on, I want the money rather than I want to change lives or save souls, so it's really disheartening sometimes. And I think that a lot of them, when they go into this glamorization, they're within their heart, they don't want to harm other people or pull other people down, but they are doing what they think they need to do to get to where they want to be.
And Dr. Flowers, I think that when we look at this, when we look at the big picture, we're talking about different categories of people. We're talking about young kids. We're talking about middle-aged adults, and then we're talking about older adults that are incarcerated, or have mental health problems, misdiagnosed mental health problems, and drug and alcohol problems. So how you deal with each of those categories is totally different. And so I think we know that it starts young. So if we can catch the 2 and 3 year olds and start to redirect them about this is right, this is wrong, discipline, all of those things that we need to be doing and encouraging these kids and training them, bringing them up. Because once they hit teenager, that's you got to look at it from you got to do a whole different perspective on that, and a whole different kind of treatment. Because now you have probably if they're on drugs and alcohol or major bipolar depression, they don't understand that. So you got that, and then you have the older people that are just it's ingrained. Their neurons are at a whole different level in terms of what to do next. Impulsive. So I think that we have our work to do in our community, and if we don't do it, it's going to get worse.
And then we have to think about the wrongful convictions that happen, in addition to people getting sent into prison instead of into treatment. Even when they do commit crimes, we have a lot of wrongful convictions that are devastating and tragic, because of all the innocent people who've been wrongly accused and falsely incarcerated, sometimes for even decades. And then, we do have the other end of the spectrum where individuals are convicted for crimes they truly did commit, but does this mean we give up on their future as being a lawful citizen? Can you tell me, why is it important to advocate for people who have made poor choices in life? And I want to remind our listeners, what health and mental health challenges are your loved ones facing that you feel will lead them to incarceration, or what are you facing that you think could possibly lead you down that road? Give us a call so we can help lead you in the right direction for help. Our number is 614-824-2139 or 824-2336. So why is it important to advocate for people who have made poor choices in life?
One of the things, about almost 20 years ago, I went to a seminar in Indianapolis, and one of our bishops, Bishop Norman Wagner, headed this seminar. And one of the things that I found out was that when they began to privatize prisons and put them in the hands of private corporations and private individuals and things of that nature, one of the things that they knew that would fuel this system, or would be the product that would make this system work, was the African American male. He was already marked by the system as someone who would fuel, because when you talk about the prison system, it takes $60,000+ a year to I guess you could say service or maintain one individual, and it takes about $20,000 a year or less to have one African American in college. And so it's just profitable for people at the top, so to speak, to use our progeny, our youth, to fuel this and to make this economic engine turn. So we have to use some wisdom and think about the future of the future of our inheritance.
I think it's important. This is an excellent question. Why should we advocate? When you look at the prison system, we have to understand that it's emerging as a stratifying force that drives and shapes social inequalities. Michelle Alexander does an excellent job in the book, The New Jim Crow, Mass Incarceration in the Age of Color Blindness. And she talks about mass incarceration being in the form of slavery, and how we have more African American males incarcerated than we had in slavery. That's a problem. When you look at prison industries and people work 35 and 40 hours a week in the prison, these inmates are working jobs and get paid $15, $16, $17 a month. And if you have fines and child support or fees or restitution, your money is taken. So it drives a perpetuating violence and a cycle of violence in the prison that's not about rehabilitation. If we're going to look at our criminal justice system, we need people that are going to stand up, be very bold, very audacious, and deliberate in their message that it is time for reform. And that reform means to look at the foundation, which are policies and procedures and laws that are taking people's lives and their livelihoods and dismantling families from poor choices. A person with mental health issues or a person with addiction, it costs less money to give them treatment as opposed to incarceration. And that's something I don't think we're looking at as a nation.
No, I think that I agree with what has been said, and I think that we must advocate for those who have made wrong choices, and I think all of us have made all of us have made poor choices. But when you talk about people that have mental health issues and misdiagnosed issues, or strung out on drugs and alcohol, their choices are not going to be the best. And so if we don't get them into treatment before, then when they get into incarcerated, then we got a really big problem there. And so I think that we have to keep working on advocating both before, and also keep advocating that these people be not thrown in prison, but what about thrown into some type of rehabilitation system?
Well, you are listening to Let's Talk About Health on AM 1580 WVKO The Praise, the voice of the people. Please join our show with your questions after this break by calling 614-824-2139 or 824-2336.
This is First Lady Jawanda Thomas from The Truth Church, and I want you to tune in every Saturday at 10 a.m. where Let's Talk About Health, because your health is your wealth, with Dr. Amanda Flowers, Dr. Mark White, and Dr. Victor McKoy, the Super Doctors, on AM 1580 WVKO The Praise, the voice of the people.
Welcome back. You are tuned into Let's Talk About Health on AM 1580 WVKO The Praise, the voice of the people. I'm Dr. Amanda Flowers in the studio today with Dr. Mark White, Dr. Victor McKoy, and Elder Patrice Palmer, discussing the health crisis of incarceration before, during, and after prison. Give us a call with your questions at 614-824-2139 or 824-2336. And Doctors and Elder Palmer, we have a listener on the line, a caller on the line, I'm sorry. Caller, you're on the air. Do you have a question for the doctors this morning?
No, I thought you were just discussing mental health issues.
Could you please turn down your radio?
I'm actually outside. I'm not near a radio.
Okay. Okay, that's okay. It was echoing into ours like you had a radio. So I'm sorry. Go ahead with your question.
I don't actually have a question. I thought you were asking people to call in about mental health issues and being arrested in the black community.
Absolutely. Did you have a comment to tell us this morning?
Yes. My son went from a scholar athlete, a college student and National Guard, to bipolar. And once he became bipolar, they wanted to just give him the strongest medications that they could at the highest doses that they could.
Yes.
And he got a condition, I think it's called humongous. And what it is that when they do that, it deteriorates your higher brain function. So now you're just using your lower brain functions, and the drawing of a person who has that, they have large lips, large hands, large feet, large genitalia, large stomach, because all they are doing is trying to satisfy appetites. Now, what helped him a little bit was that I actually had his power of attorney because he was in the National Guard, so they could not just do anything to him. So I took them back and forth to court several times about his medication. And what ended up happening was, initially he was off his medication. He stole a donut. The guy from the filling station chased my son. My son was on the bike. He chased him in his car, hit him on the bike, jumped out the car and jumped on him. The police came and arrested my son, charged him with burglary for a donut, kept him in jail for almost a year. So then when he got out, he really did commit burglary. And he had no record.
Yes, and we see that oftentimes when it will be minor things that people do or minor decisions that they make, and you go into incarceration, and because of all the things that happen behind bars, people will come out, with worse situations or worse behaviors than what they go in with. And we are going to be talking about that here in a minute on the show. So we do thank you for calling in, and we hope you continue to listen to our show. And right now we have it's so funny that this extra special guest came in on this topic, because we have Judge Pettigrew, who is here with us this morning, and he has come in to talk about the African American Male Wellness Walk, but he may be able to give us a little bit of insight on the topic at hand as well. Dr. Pettigrew, we welcome you to the show.
Well, thank you so much for having me, and I'm glad to be close to the medical director of the African American Male Wellness Walk, Dr. Mark White.
Yes.
I'm coming today just for one simple reason. That's to invite people to participate in the Green Bucket Day. Green Bucket Day, and there are some people right down here at Courtright and down here at Alum Creek who are out with the green shirts like I'm wearing and yellow and green buckets to allow people to vote for health and wellness in the African American community. When you go by, they're asking you drop something. Quiet donation is preferred, dollars, $5, $10, $20, whatever it might be. But the point of it is, all of that is going to subsidize free health screenings on August 8th at the 11th Annual African American Male Wellness Walk. It'll be down at Children's Hospital, really at Livingston Park, adjacent to Children's Hospital. And so we're inviting everyone to participate. These teams are out. There are about 60 or 65 people. They're out on Cleveland and Maine and Livingston and around the city. So if you travel down a city major street, you should see them pretty quickly.
Yes.
So that's the reason, and quite frankly, we don't have a lot of dissent on improving health and wellness in the urban community. Now, you know that the walk started with Save a Black Man. Now, there are a lot of people that don't agree with that right now, so we still say Save a Black Man. But your thing about incarceration, unfortunately, I heard something a few weeks ago that's actually disturbing, because I went to law school because I wanted to help people with legal issues.
Yes.
Didn't have any lawyers in my family or college graduates. But I heard a speaker say that a guilty white man will be treated better than an innocent black man in our criminal justice system. Now, the problem I have with that is it's true. If I could say, oh no, but it's true.
Yes.
And so when you talk about the incarceration and the rates and the numbers, and you talk about the length of incarceration, the fact that the guilty white man may go for 1 year, but the black man's going to go for 10 years. We have to understand that prison incarceration is a business.
Yes.
And the state of Ohio recently extended contracts to private prison operations. And they did one other thing. They guaranteed them 90% occupancy. Well, how are you going to guarantee that somebody's going to be in jail unless you run the courts?
Yes.
Which eventually sentence them to jail so that you can live up to your contract that says, we're going to give you 90% occupancy. What I keep saying over and over again as I travel around now is people need to pay, and I don't mean pay money, I mean pay attention. You need to see what's going on. That article a few weeks ago in the New York Times, 1.5 missing black men, it's because of health issues and incarceration.
Yes.
Because when you say, well, where are the young black men for marrying our daughters? They're incarcerated.
Yes.
They're on drugs. And so things are upside down.
Yes.
Okay, I understand we have a lot of issues going on, a lot of political discussion, but really, health, which can be physical as well as mental, and wellness, which has to do with security. Talk to a group of young black men. What's your number one concern, 18 to 21? That somebody might shoot me. Who are you worried about shooting me? Somebody who looks like me or somebody who's wearing a uniform?
Yes.
Wellness is a broad concept, and I know you didn't. I didn't come here to give a speech, but by the same token, I've been under the tutelage of Dr. White. Dr. White keeps talking about the fact that if you don't get the mind right,
yes,
he has limitations as a medical doctor on what he can do for your body.
Absolutely.
Okay, so it all fits together.
Yes.
And like I said, for people in the city, like for you to get out, they'll be out there until 3 o'clock this afternoon. Go up and down whatever major streets, stop at an intersection, make your vote in the form of green, and then support the walk. And then come out on August 8th. We'd like to have you as well as the thousands of other citizens come and participate. So thank you very much.
Thank you. We really appreciate it. And I want to comment on, I did a speech talking about the single fathers. And when we look at our single fathers, the media makes it look like our African American fathers are not doing what they're supposed to. But when you look clear across the research, across the entire board, African American fathers are faring better than all other races are as being single fathers. And one of the things that I looked at was that New York newspaper article that you were talking about. And when we say there's 1.5 million of them missing, you take away the part that's incarcerated, and that brings our missing African American fathers less to 1 million.
Well, let me just interrupt one more time. We had, on June 14th, we had a fatherhood summit here in Columbus, sponsored by the Walk. And there were 5 young men who came, but they brought their children with them. Most of the men who came, we had 100 and some people, but most of the people, well, Dr. White was there. Most of the people who came alone, but they brought their children. One had 5 children, the others had.
Yes.
So fatherhood is strengthening, and certainly fathers are paying attention.
Absolutely.
All right, thank you.
Thank you.
Thank you.
Well,
Thank you.
we have a caller on the line. Caller, you are on the air. Do you have a question for the doctors or for our guest this morning?
Actually, I have a comment and a commendation. First of all, thank you for addressing this issue. And I beseech you to perhaps address this over the next couple of Saturdays, seeing the scope is so large and far too large to address in just one setting. Also wanted to thank you for addressing the work by Professor Alexander. It is so critical, particularly as it pertains to Black Americans and the new Jim Crow, and then all the offshoots of that being the privatization of the prison system. Perhaps that also could be a topic of discussion in one of your future shows.
Yes.
But really just wanted to commend you guys. I love the show. I love the work you're doing. I'm a good friend of Dr. McKoy. And I just pray that you could expand this, perhaps maybe go 2 hours or several times a week. But it is an excellent vehicle for the Black community. So thank you.
We thank you so much, and I do want to let you know that we have a series on this for the next, it's probably going to be the next 3 months. We have someone coming in once a month to talk about this issue. So I do want to thank you, and one of the things that we will make sure that we talk about is the Jim Crow information. So thank you for pulling that in, and we will definitely, it's funny you said we need 2 hours, because this was a conversation Dr. White and I were having when we were driving into the studio this morning, so I will pass that information along.
Yes, amen. God bless you, God bless you.
Yes. Thank you for calling in, and we do hope that you continue to listen to our show. Well, the overwhelming majority of individuals in jails and prisons have experienced trauma that has scarred their minds and hearts. The experiences that trauma survivors have in the criminal justice system lead them even farther from positive changes in their life, often adding new trauma to deepen their wounds. So, doctors and Elder Palmer, can you tell me, what experiences do individuals face behind bars that leads to them to have health and mental health problems? And also, what role does grief play in the life of prisons?
Okay, I would say that the experience behind prison walls, I don't think society is aware of the vicious, violent, and the cycle of incarceration. For example, a person that is 16 years old, sentenced to prison for 10 years. In prison systems, they have a juvenile unit, but they're still in prison, being influenced by people that have been there for years or multiple offenders. So the impact of the incarceration, psychologically, emotionally, mentally, of going to prison. If you are, say you have 10 people connected to you and you get 10 years, that's 110 years the system gets for that one crime. Mm-hmm. Because everyone connected to you is doing time just like you're doing time. The cycle inside of prison leads to health issues and mental health issues because people are in fear of their life. People are being extorted. People are gang related, and you have this code and this part of the city, this part of the city that are connected, and there's all kind of violence, not even to mention the dynamics from the staff or being rude, disrespectful, and degrading to people that are incarcerated, calling them animals, treating them disrespectful. In the mental capacity, I mean, think about it. If you're used to being free, going to your refrigerator anytime you want to, and now you are caged in and you have limitations to your movement, that's going to do some type of damage to your psychic, period. The grief process is that people have deep sadness. Some people are full of remorse. Some people are devastated at the choices that they made or the harm that it has caused them, their families, and those that they love. And it's about pain and distress to be incarcerated. It's not a joy or something that's funny. Imagine someone disrespecting you every day of your life, and you feel like, I have no hope. I can't say anything back because if I do, I'm going to the hole, which is an isolation. So people are going through mental stages and dimensions that affects them for life. And if we don't get a hold of it, we're releasing more angry, more bitter people. Think about people that are incarcerated that did not commit a crime, but were found guilty from a jury that really wasn't even engaged in the process, but the person was found guilty even though they didn't commit the crime. They're angry and they're bitter. Yes. And then to have limitations, I'm really bitter. And then you're told who can visit you, what you can do, how you can eat, where you can go, what you can wear, constantly. That is degrading to the mental and the psychological and emotional stability.
And then when we think about the trauma that is faced as well, you're put in this place where you don't have any friends. You make friends, and then someone commits suicide, or you make friends and someone stabs your cellmate, or you see a fight that breaks out outside in the yard or wherever in the and someone gets hurt or gets killed. I mean, it's trauma that they are seeing over and over and over and over again that we don't even think about. And then, to be cautious about who you pair up with. So if something happens, your friend in there is going to be able to help save your life. And then we talk about the people who are raped inside of prisons as well, and this is just not between inmates, but this is between our law enforcement and inmates as well. It's just a whole lot. And then when you think having a loved one in prison is one of the hardest experience that a person can have, and incarcerated individuals and their families look forward to the day that they go before the parole board. For some, this is a wonderful day, but for others, it's an experience of reconviction and punishment. And you had talked about this as well, Elder Palmer. Can you tell us how does going before the parole board impact mental health?
It's an issue. I'm going to say that. And one in which Franklin County, the state of Ohio, is looking at for the first time very, very seriously, because people are being reconvicted of their crime. And one of the guidelines for the parole board is to not reconvict them. So if a person goes before the parole board, for example, from a murder, and they have a murder charge, that murder charge is not going away. So to re-condemn me on top of being there 20 years, and I've done every program that there is, how do you not be able to look at me differently? You're going to always look at me as that crime that I've been convicted of.
Absolutely. Well, you're listening to Let's Talk About Health on AM 1580 WVKO The Praise, the voice of the people. Please join our show with your questions after this break by calling 614-824-2139 or 824-2336.
This is First Lady Jawanda Thomas from The Truth Church, and I want you to tune in every Saturday at 10 a.m. where Let's Talk About Health, because your health is your wealth, with Dr. Amanda Flowers, Dr. Mark White, and Dr. Victor McKoy, the Super Doctors, on AM 1580 WVKO The Praise, the voice of the people.
Welcome back. You are tuned in to Let's Talk About Health on AM 1580 WVKO The Praise. I'm Dr. Amanda Flowers in the studio today with Dr. Mark White, Dr. Victor McKoy, and Elder Patrice Palmer, talking about the health crisis of incarceration before, during, and after prison. Give us a call with your questions at 614-824-2139 or 824-2336. And we have a caller on the line. Caller, you are on the air. Do you have a question for the doctors this morning or for our guests this morning?
Yes, ma'am, I do. I actually have a question as well as a compliment. I just want to thank you guys for doing.
And caller, do you have your radio
for your
on?
efforts to try to empower our community. I also have read Dr. Alexander's book and think it's wonderful, very, very helpful to understanding the present state that we're in regards to the disparity between the African American community and everybody else in terms of incarceration. So I guess my question would be, what steps or what tools do we as common citizens have to help enlighten, educate, and I guess try to reduce the amount of incarceration within our young men, particularly, and the African American people as general.
Okay. Couple things. One, I think that we need to speak out to mental health and emotional health, starting with the little kids, 2, 3, 4-year-olds. One, I think we need to do that. And I think, two, we need to go to our legislation and legislators and talk about how do we make mental health treatment more accessible. There are tons and tons of people walking around Columbus that are mentally challenged, undiagnosed, not treated, homeless, the whole deal. So we need to get on board and first of all make mental health and emotional health put it on the board, put it out there, make it not take the stigma off of it, so people can start talking about it openly and freely.
Yes. And another thing that's really great, Dr. White, and that comes along with the awareness, raising the awareness and the consciousness of people in the community, and getting the right and the valid information into the communities. Town hall meetings. I applaud the efforts of Bishop Jerry Pierce with the Moses Movement. He has town hall meetings that brings the newest information or legislative things that are going on in the community so that people can come out. You got to get involved. You have to be able to speak out. There's the Franklin County Reentry Task Force. You can speak at that task force about issues that surround our community. There's Restored Citizen Summits that you can be a part of. There are different things going on for the first time, really, here in Franklin County that are moving across the state of Ohio. The Father to Father initiative, the Stepping Up initiative with Franklin County, County Jail, something we've never had before, the Male Wellness Walk. That's an empowering event. That's something that will change lives. That's something that will empower lives. So it's about getting involved, seeing what kind of things are going on in the community, and getting connected to those things and being a voice and advocating.
And caller, we do thank you for calling into the show this morning and giving us your information and asking your question. We hope you continue to tune in on our show. And before we went to the break, Elder Palmer, you were telling us a little bit about how the parole board and how going before the parole board impacts mental health.
A person from my time at CCI, many of the men that we service had to meet a parole board, and it's a devastating moment for them because for many of them, they've done everything that the board has asked them to do, and then to go before the board and not get a release date, but to come back. You have to come back in 2 years, 5 years, 8 years. So mentally, it's devastating because you've done all that you know how to do. Your crime is not going away. And so one of the guidelines, there's 17 guidelines in the parole board, and they have to meet them. Why is that so? Because it's never been challenged. So right now, there's some programs that are challenging the parole board's decision and why a person has to meet every requirement. And so they're looking at that because a person should never be reconvicted or retried or recharged when they have done some things that are significant for redemption, and they should be given an opportunity.
Yes.
At this time, I'm going to give a shout out to your pastor.
Thank you.
Dr. Bishop Sherman S. Watkins, who's the presiding prelate and bishop over the Higher Ground, always abounding organization.
Yes.
Wonderful man of God and a close friend of mine. I love him, and I just want to give a shout out and say praise the Lord. And keep doing the wonderful work that you're doing.
Thank you. And I just want to shout out to him as well because he's a very prayerful pastor and very supportive of all the things that I'm doing, both locally and nationally. And so to be able to tell him and ask him and have his covering to do this type of work is amazing. So I'm honored and I'm blessed.
Yes. Well, prison and jail inmates with physical health, mental health, and substance use problems experience more reintegration difficulties upon release, and they typically have poor outcomes with respect to employment, reoffending, and reincarceration. Some inmates receive health care while incarcerated, but several barriers contribute to even more declines in treatment and functioning once released. But maintaining these, this treatment and increasing treatment from what they are receiving for their health problems will improve post-release outcomes. Elder Palmer, I want to start with you because you have, we're tying in like 3 questions into one right here.
It's okay.
So, can you tell us what are the barriers for re-entry into the community? How do we overcome this with the family? And can you let us know what you are doing to work on this in the community, and how our listeners can get in contact with you about these things?
Okay, let me see if I can remember the questions. Now I got them.
Okay.
So the barriers to reentry is that we don't have a society that believes in redemption. Second chances. Sometimes second chances mean 2, 3, 4, 5 chances before a person gets it right. Before a person has that epiphany and that aha moment that I've got to change the things that I'm doing. When people begin to look at their patterns. For example, myself, I have 4 prison numbers. I'm not proud of any of them, but it took me hitting my head time after time after time before I came to the conclusion that, whoa, I got to change something. Crying out to God, asking Him, help me, because if you don't, I'm going to self-destruct. And surrendering to the process of change and allowing God's power to change who I am from the inside out. And so it's that redemptive power and that restoration that our society lacks. And it's time for the church. It's a call to duty to step up and be the voice that brings about systematic change, because we represent a power that is greater than anything. And so that's the barrier. The barrier is me, the person. I'm the barrier. Then we have the systematic barriers: employment, housing, education, all of those dynamics. But by the grace of God, I broke through all those barriers. I have a master's degree today and licensed as a social worker, chemical dependency counselor, all of those things.
And an elder.
And an ordained elder at higher ground, always abiding assemblies. Right. Because of the power and the grace and the mercy of God. And we cannot leave God out. And I think as a society, we have left God out for far too long. We have made decisions, laws, rules, regulations without the guidance and the instructions from God. The word says that if my people, which are called by my name, would humble themselves and pray, right?
Yes.
If we would turn from our ways, seek His face, then we'll heal from Him and He'll heal the land. We keep trying to do it all other kind of ways. So we need to move forward in redemptive measures. And redemptive measures means that by the grace of God, I'm not who I used to be. And we have to empower people and give them hope, because when you can restore the dignity, the value, the worth of a person, you restore a productive citizen back into society.
Yes.
So some of the things I'm doing locally, I'm a part of the Franklin County Reentry Task Force Coalition. And I am the representative at large. And so I represent all the voices of people that have been formerly incarcerated or that are incarcerated, and I advocate for systematic change. One of my very good friends, Ray Miller, when he was senator, he calls me, he said, Miss Palmer is going to come and speak truth to power. And that's by the grace of God, that I'm not here to, just have another thing on my resume, but I'm here for the voice of the people. I'm also a part of the Restored Citizens Summit, a part of Just Leadership USA, which is a national organization in collaboration with Columbia Law University in New York, and it's called Leading with Conviction. And what our mission is to cut the prison population by half by 2030. How are we going to do that? We're going to drive policy reform.
Amen.
We're going to drive restoration and redemptive services and things that can bring people to a better place and better space in life. And what Just Leadership is about, those who are closest to the problem have a solution. And so that's how we are leading with conviction. I speak in Washington in a couple weeks at the Criminal Justice Summit. And so just advocating and doing different things. I speak at different churches and different organizations throughout the city, collaborating with St. Vincent de Paul, and Wendy Tarr is a community organizer, so we're collaborating together. We've collaborated, and we have an organization collaboration that we started, Restored Citizens, that we meet once a month. The third Monday of every month, and we're moving forward in some restorative measures, and we go to legislation and advocate. We were just there on House Bill 56, which is the Fair Hiring Act, which gives people with criminal records an opportunity to present themselves, their skills, their qualities, and what they have done in order to have gainful employment instead of being counted out. We have House Bill 78. So we go before the Senate and the House of Representatives, and we advocate for changes. So that's who we are and what I'm doing. And you can reach me by Chosen for Change as a nonprofit organization, and the number is 614-954-2424.
Thank you. Dr. White, Dr. McKoy, any final words?
My final word is sugar is a toxic substance.
And I just want to, I think that I want to thank Patrice for coming on. But thank her for all this good information. I'm taking notes and getting cards, and I'm on board.
Okay.
I'm on board.
All right.
Definitely.
Right. All right. I want to say one final thing.
You're fine.
There's going to always be a time that we are faced with injustices, but there must never be a time that we fail to protest those injustices. It's time for us as a church to stand up and answer the call of duty.
Absolutely. Well, we do thank all of our listeners for tuning in to Let's Talk About Health today. Tune in next week to hear what the doctors have to say about losing weight when health complications get in the way of exercising. And we have a featured guest, Candace Mims, on the show, who is proud to tell us about how she has lost way more than 100 pounds and had a difficult time exercising because of her health complications. In the meantime, remember to stop by our studio at 3360 East Livingston Avenue at Suite 2A and show your support by giving a donation. We also want to remind all of our listeners to tune in and give us to check out our webpage at 1580thepraise.com/Let's Talk About Health. Remember to like our Facebook page at Let's Talk About Health, AM 1580 WVKO The Praise. And you can also email us at ltah1580@gmail.com. Remember, your health is your wealth. Let's talk about health.
All right.
Woo!